I know you've been looking for a target for quite some time. Explain how you landed here.
Well, good morning, Andrew, and thanks. I'm really excited to be here. I want to start by saying this is a really feel-good company. This is a company and a great story and a poignant story for our time. I mean, Dr. Marlo Hernandez is a Cuban immigrant, and he came to this country when he was 8 years old. He didn't speak English. He actually went to medical school and during medical school started his first clinic taking care of the people in his community that were poor, underserved, and had no access to great health care. And he built that into Cano Health, which in 2019 was the fastest growing healthcare company in the United States. It was kind of under the radar screen because it wasn't backed by one of the big name VC firms from, let's say, California, but it wasn't under the radar screen for Humana. They bought a 5% interest in the company and aren't selling a share in this offering. And you'll see from its stats, it's one of the largest players in the country in the most important market, growing market of the healthcare market, which is Medicare Advantage. So, and also, I was
Barry,
35 when, sorry.
I was just going to say, we normally think of you as a real estate investor. So how did you even get interested in this?
Okay. So I said our SPAC, which launched in May, so it's been about 6 months, wasn't going to do real estate, and I wasn't going to compete with my funds. And I wanted to invest in something that wasn't sensitive to the economic cycle, that wasn't impacted by rising interest rates, that wouldn't be impacted by trade wars or currency crises, and just could withstand the economic cycle. That leads you to healthcare. I actually called a friend of mine in a company I invested in called Devoted Healthcare, a very fast-growing insurance company, and I ran by him a bunch of different names in healthcare. When I got to Cano, he said, "Stop, that's a really great company. If you can do something with them, you should do it." So we sought out Marlo and Dr. Hernandez, and we learned a lot about the company. That only got us more excited. So this is a very fast-growing company, and I was going to say that when I was 35, I started Starwood Hotels. We grew it from 8 million equity market cap to 20 billion. We're the largest hotel company in the world measured by cash flow in 4 years. Marlo's 35 too. He's actually 11 years into his career at Cano, but he has an opportunity to build even a bigger company faster than I did. So hopefully I can mentor him and help him along the way. I'm excited to join the board. I'd like you to hear from him about this company.
Well, thank you, Barry.
I was just going to say, understand. Go ahead.
Yeah, no, truly an honor to work with Barry, and thank you, Andrew, for this opportunity. So excited to tell you about Cano Health. We're a pop health management company. Population health is what we do, and we deliver on the elusive triple aim of increasing healthcare quality, lowering costs with a great experience through our own medical centers, our affiliated centers, our pharmacy. We're an end-to-end population health solution, and we've got the results to prove it. Not only best-in-class quality scores and lower utilization, but also, we have a lower mortality rate 3 years in a row. We're one of the few companies in the country publishing that, and specifically during COVID, we were able to reduce mortality by 60%. Remdesivir doesn't yet have proven ability to lower mortality. Cano Health does, and we're going to be publishing those results in over 30,000 patients. And it's not because we're using a better drug or we have a better surgical treatment or better hospitals. No, it's because we're doing the more basic stuff better. We're coordinating care. We're engaging with our patient. We have a passion for what we do. We're reflecting the communities we serve, which are typically the underserved. And listen, 30 years ago, I was just a kid in Cuba. I didn't have freedom, didn't have opportunity, didn't have hope, but my parents worked extremely hard. They were able to get me out of there. I had an opportunity, and I'm living here the American dream, and we have a responsibility to give back. And how proud are we, a company of immigrants, of those with chips on their shoulders that want to do good for the community, and the market rewards that, for us to make such an impact in U.S. healthcare. And that's what I'm so excited, partnering with Barry and Joe and the rest of the team.
Shepard Smith here. Thanks for watching CNBC on YouTube.